2.
Good afternoon, everyone. My name is Carleen Kerr, and I'll be your moderator for the COVID-19 update for Wednesday, July 13th. We are joined today by the Yukon's Deputy Premier and Minister of Health and Social Services, the Honourable Tracy-Anne McPhee, and the Yukon's new Chief Medical Officer of Health, Dr. Sudit Ranade. Our sign language interpretation is being provided today by Mary Thiessen, and André Boursier from French Language Services Directorate will translate any questions from French-speaking journalists. Following our speakers, we will go to the reporter in the room and then open the phone lines for questions from reporters. We will call you by name, and you will each have one question plus one follow-up. Before we begin with our speakers, I would like to verify that everyone can hear us. If any reporters are having a problem, please email hss@yukon.ca. Minister McPhee.
Thank you very much, Carleen. Good afternoon, everyone. Thank you for coming and or watching or listening online. I acknowledge that we are here on the traditional territory of the Kwanlin First Nation and the Ta'an Kwachan Council. I'm very excited to be here with the Yukon's new Chief Medical Officer of Health, Dr. Sudit Ranade. Dr. Ranade brings a wealth of experience, education, and knowledge to this important role that guides Yukon's public health system. He has a doctorate in medicine from the University of Ottawa. He completed his residency training in family medicine and public health through Queen's University. And he has a master's of public health and a master's of business administration. Dr. Ranade is certified by the College of Family Physicians of Canada and by the Royal College of Physicians and Surgeons of Canada in public health and preventative medicine. Just by way of a short introduction. Most recently, Dr. Ranade has been living and working as the Medical Officer of Health for the County of Lambton in Lambton Public Health in Ontario, and he's done that for the past 10 years. Dr. Ranade's leadership and experience will serve Yukoners well, and I'm very pleased that he has decided to move his family here to the Yukon, and we welcome him. I join Yukoners in welcoming Dr. Ranade to the territory, and I look forward to him continuing to work on important public health work that ensures our communities are safe and healthy for all Yukoners. I'm also very pleased to announce in this forum that we announced last Thursday that all Yukoners over the age of 18 are now eligible for a second booster shot of vaccine. There are appointments available online at yukon.ca/appointments, and there will be more available in the weeks to come. To be eligible for your second booster, 6 months should have passed since your first booster or since your last vaccine. And for people who have recently had COVID-19, a second booster is not recommended until at least 3 months have passed since COVID-19 symptoms started or since you've tested positive for the virus. And it's been 6 months since your first booster. I'm sure Dr. Ranade will have more to say about this development. I encourage everyone to stay up to date on their vaccinations as soon as they are eligible, including booster doses. Vaccine, as we know, offers the best possible protection against COVID-19 and against having serious outcomes such as hospitalization or even death. Check yukon.ca appointments to book your vaccine appointment and check the clinic times. Those are available here in Whitehorse and at clinics and medical centers throughout the territory. We've recently received a recommendation from the Interim Chief Medical Officer of Health, Dr. Hasselbach, and that's been endorsed by Dr. Ranade as he comes on to his new role, that we end the vaccine mandate for workers, contractors, and volunteers working in high-risk settings. We are considering all recommendations from the Chief Medical Officer of Health while keeping in mind that vaccines continue to offer the best protection against severe outcomes such as hospitalization and death, and knowing that the Omicron variant has a high rate of transmission. As we continue to learn to live with COVID-19, we are starting to take cautious steps towards treating it like other respiratory illnesses. Dr. Ranade is reviewing our approach and making recommendations for the territory. We expect the recommendations to be that we shift from the acute stage of the pandemic response to part of our ongoing work to support public health for Yukoners. Dr. Ranade will speak a bit more about the new recommendations that he's been working on to support this transition. We've put him to work right away. One of our top priorities for public health is working collaboratively with First Nations governments and community leaders. Dr. Ranade will be engaging with leadership throughout the territory and having discussions related to COVID-19 as well as other public health matters. We introduced Dr. Ranade to community leaders and First Nation government leaders yesterday on a community call, and we expect to have more of those going forward. Some of the work we will be doing includes reviewing our COVID-19 response, which will lay the groundwork for the fall of 2022, when we expect to see some increased activity in respiratory illnesses of all kinds. I want to take just a moment to thank Dr. Elliott for stepping in and for working so hard to support Yukoners throughout the pandemic, and for her continued dedication and expertise in keeping Yukoners healthy and safe. Again, I encourage all Yukoners to stay up to date on their vaccinations and to get their second booster dose as soon as they're eligible. I'd now like to introduce you to Dr. Sudit Ranade and to thank him for joining me here today, and I look forward to the comments and the updates he can provide Yukoners. Thank you.
Well, thank you. Thank you, Minister McPhee, for that very warm introduction. It's really wonderful to be here. I want to acknowledge that we are here on the traditional territories of the Kwanlin First Nation and the Ta'an Quechan Council. And I'm very happy to be here working in the Yukon. I will, Minister McPhee covered all of the groundwork here, so I really only have a few additional things to add to that. So the first part is the COVID situation. Broadly speaking, right? So the first piece is that we are actively watching what is going on in other jurisdictions with respect to waves that are happening in the summer and examining what impact, if any, that will have on their health systems in order to predict what might happen here with the recent waves that you're seeing. But in a larger sense, we need to begin to incorporate the response to COVID with the response to other kinds of respiratory viruses that will co-circulate with COVID-19. And part of that response is making sure that folks are up to date with their vaccines. So you'll note that 18 plus residents of the Yukon are now eligible for a second booster dose, and we encourage you to get that when you're eligible. Remember that if you are in the rural communities, that you can contact your health center for appointments related to vaccination. And if you are in the Whitehorse area, there is an online booking system, and that booking system is responsive to bookings. And so what that means is, or maybe I'm getting that word wrong, but what that means is if you go into the system and you can't find appointments, that means the system is that the system is full of appointments and more appointments will be added. So really the point is to keep checking that website so that you can book an appointment to be vaccinated. And the routine pieces are still there, right? If you are thinking about traveling around the territory, ensure that you're looking at travel advisories and monitoring for wildfires floods and other public health measures in other jurisdictions that you might be visiting. Obviously, if you have symptoms, remember to stay away from others and to stay at home while you're recovering from those symptoms, regardless of whether those are COVID or not. And we will continue to monitor the situation closely with respect to COVID so that we can scale our response as needed. In terms of the vaccine mandates, Minister McPhee covered that we have made recommendations with respect to the removal of those, and they will be considered shortly. And in terms of the COVID dashboard, you should know that we are also in keeping with this idea of transitioning to a more sustainable method of dealing with COVID, changing the frequency of COVID-19 dashboard updates. So currently they happen daily, but we'll be moving to weekly and monthly updates depending on the specific indicator that's being monitored there. And that's part of recognizing that the daily or weekly fluctuations are not as meaningful in terms of risk as the overall trend. And I would just like to remind everyone as well that there have been also some changes to the case and contact management guidance as in the Yukon. And so we recommend that contacts of known cases self-monitor for symptoms. If you develop symptoms, then you do what anyone with symptoms should do, which is to stay away from others and be home while you're recovering from those symptoms. And then just remember again that we do emphasize that people should get their vaccines when they're eligible, and that those are now eligible to a larger pool of people for the second booster doses. As we look to the fall and we're thinking about waves now and waves then and creating a more sustainable response, we'll be reviewing the overall COVID strategy, right? The Forging Ahead document and planning for revisions that can incorporate the new reality of COVID, which is really that it's going to be with us for the longer term, and we have to make adjustments to how we deal with COVID with respect to how we deal with other illnesses. And so we'll be reviewing that and putting some recommendations forward as well on that. So I think that I've covered the things that we were supposed to cover here. So I'll just leave you with thanks and thanks for your time today.
Thank you very much, Minister. And Dr. Ranade will now take questions from reporters. A reminder that each reporter will get one question, followed by one follow-up. So we'll start with the reporters in the room and with Julian from the CBC.
Hi there, Julian with CBC. The test positivity rate at last check this morning was at 52.3%. There's also one new COVID case, and as McPhee just mentioned, the vaccine mandates will be scaled back for workers, et cetera. How do you square, I mean, that's a very high test positivity rate. How do you square all of those variables?
Can I do that? I'm
Sure.
happy to touch base, but you go ahead, please.
So, I think so this focus on test positivity and cases is really it harkens to that sort of acute response phase, right? And so changing the requirements around vaccine mandates and these other things are really more about creating a sustainable response, right? So test positivity is going to go up and down, and test positivity depends on who's eligible for testing and how the tests are conducted, but it may not be the most reliable indicator of what's happening, right? Because a lot of people would have symptoms and not get tested, or a lot of people might get a test that isn't reported. And so the utility of these measures to figure out what the real burden is reducing, right? So I would encourage you not to focus on just, the test positivity numbers and how they're changing, but to really say we are going to experience a wave. It's unclear how high that wave is going to be. And the response is really going to be guided by what is the overall burden in terms of illness in the communities, as opposed to the test positivity or the number of cases that we see.
Do you have a follow-up, Julian?
And I guess for clarification, that sort of means living under this new reality, as you mentioned, that, COVID's going to stick with us for a long while. Is that what you're referring to there?
Yes, that's exactly it. Mm-hmm.
Okay, no more questions.
Thank you.
All right, we'll go to the reporters on the line now. Over to you, Amy, with the Canadian Press. Amy, if you're still with us, you might be on mute, as we cannot hear you.
Sorry, yes, I was on mute. I know you said the vaccine mandate recommendation will be considered shortly. Can you give me an idea of a timeline of when that might be implemented?
I can tell you that we received the recommendations from Dr. Ranade and Dr. Hasselbeck late last week, if I'm remembering that correctly. We've been working on taking that. The process, of course, requires me to take those recommendations and any actions anticipated to Cabinet and through that process, and I expect that to happen perhaps this week, depending on whether or not we're ready. And then if the mandate is removed, it becomes an immediate action.
Amy, do you have a follow-up question?
Yes, my other question has to do with the recommendation to shift away from an acute response. Can you give me an idea of, for the average Yukoner, what will that shift mean for them day-to-day life? You spoke about the dashboard, but I'm just wondering if that would affect kind of any rules or restrictions or policies they live with.
Yeah, please.
Sure. Yeah, it's a really great question, and I think it's going to take some time to figure out exactly what that means for everyday life. I think the real piece of it is to say there are parts that we were treating as a separate entity, a separate response, that there's COVID and there's everything else. We have to start bringing that sort of COVID response and how we react to it into the more routine ways of doing things. And so that's related to government functions in terms of who's operating on what files, but it's also related to health system functions around sort of when does testing happen and why? Under what circumstances are we going to be using different kinds of tests? And so in some ways it might impact folks that way. And then the larger piece is really around some of the sort of more of like a cultural shift really in terms of how we approach COVID as a group, as a society. And it's hard to say exactly what that will mean for any individual, but it's really, it's going to be a process of shifting people over to that.
Thank you, Dr. Ranade. Over to Tim with the White Horse Star.
Yes, hello, can you hear me?
Yes. Oh.
We can.
Yes, okay. So my question is for the doctor. Is there any sign of the subvariance of Omicron here in the Yukon as yet?
There is. So I think we've seen some proportion of the tests coming back as BA5 positive, but I think and you're going to see more of that, right? So BA4 and BA5 are going to become dominant variants. I think we have to pull back and think about the whole discussion about these variants, right? So because they become less and less relevant the more and more there are of them, right? And so the greater focus really needs to be on not what variants are there, but what kind of disease are they causing. And for the most part, what we're seeing is that they cause milder disease, especially in highly vaccinated populations. And so that's really important to remember in terms of what we're going to see going forward.
Tim, do you have a follow-up question?
I do. Do you have any plans on publicizing those kind of numbers and which variants are circulating, as has been done previously?
I'm not sure I can speak to that right now. I mean, I think we can take a look at what kind of indicators and information we're publishing. We sort of routinely try to look at that to see that it's meeting the needs of the population. But as we move to a place where we're thinking about integrating the way we approach COVID with the way we approach other things, you might start to see a move away from some of those specific details on variants because they may not have that much population level significance, right? So they're more information items as opposed to something that is creating a specific or defined action.
Thanks. I would just like to add to that because I appreciate these questions. Tim, there are often questions that Yukoners are concerned about, and I know Dr. Ranade knows that as well. I think that approach is exactly where we need to go, and certainly that's the recommendations we've received. One of the things we will be continuing to encourage is vaccinations, because we know they have a positive effect on outcomes, even if there is a high level of transmission in community. We know that vaccinations help individuals deal with all aspects of COVID-19. I also want to take this opportunity to say that we encourage individuals that want to continue to wear masks. I think our community has been very supportive and open. Lots of folks are continuing to wear masks in places when they're mixing with folks that they don't normally mix. A grocery store is a great example. Maybe an event where there's more people than you've been in touch with before. And masks are an individual choice, and certainly they're encouraged in many public buildings, and they're encouraged for Yukoners who want to continue to protect themselves with a level of protection that is higher than not having a mask. So certainly want the chance to say to folks that we're very supportive of that, and it will be one of the things that goes forward, no doubt, and affects respiratory illnesses of all kinds, no doubt.
Thank you. We'll move now to Dana from the Yukon News.
Hi. I'm wondering, my question is for Dr. Ranade. Is wastewater testing a good idea for the Yukon, and is this something that you would recommend?
That's a good question. Let me say that lots of jurisdictions have tried out wastewater testing, and there's been lots of back and forth about sort of what it can do. I think it's really an intriguing and it's a place that we still have to do more work to understand exactly how the wastewater surveillance can inform decision making. So that's one of the biggest pieces around. It's one of the biggest unknowns around wastewater surveillance is how can it really push decision making as opposed to being information that is just for information's sake. And I think that. There may be applications in the future. It's sort of an ongoing area of conversation with no definitive answer as yet.
Thank you. Dana, do you have a follow-up question?
Yes, I do. I'm just wondering if you can clarify what indicators are you looking for to determine the issue of COVID-19 in the territory?
Sure. So currently, I think we monitor a set of indicators that's published on the dashboard. So you'll be familiar with those. But in terms of moving forward, there's a few pieces. One is you're looking at indicators of severity. So you're looking at hospitalization data and that sort of thing. That's probably one of the largest areas of focus, because the issue is not going to be as much about how many people have COVID as to how many people are getting very sick with COVID. That's a different approach. It's a different strategy, and it requires some different indicators like hospitalizations. There might be some others that we'll explore over time, but that's probably a key one for now.
All right. Well, thank you all very much for joining today's COVID-19 update with Minister McPhee and Dr. Ranade. Thank you, everyone, for your time, and have a great day.